Hello, and thank you for joining us today for a discussion about COVID-19 vaccine and children. My name is Ashley Antle. I'm a writer with Cook Children's online newsroom. I'm also a mother of 3 young boys, and if you're like me, you have a lot of questions about the COVID-19 vaccine, especially when it comes to giving it to your children. We're here today to hopefully answer some of those questions. The questions I'll be asking are not only my own, but also come from parents who are members of Cook Children's Family Advisory Council. To be fair, there are a number of questions that we won't get to today because we simply can't answer them yet. There are 2 vaccines currently available that have been approved for emergency use by the FDA. Those are with Pfizer vaccine, which has been approved for 16 years and older, and the Moderna vaccine, which has been approved for 18-year-olds and older. So there is still a lot of information needed when it comes to the vaccine for younger children. But we hope the information we can provide today is helpful as you begin to consider the COVID-19 vaccine for your children when it becomes available to them. Joining me today is Dr. Mary Suzanne Whitworth. She is the Medical Director of Infectious Diseases at Cook Children's Medical Center. Dr. Whitworth is also a mother and has faced the same challenges of parenting in a pandemic that all of us have faced over the past 10 months. Dr. Whitworth, thank you for joining us today.
Thank you for having me.
I'm going to jump right in and get started with our first question. The 2 vaccines currently approved for emergency use by the FDA are new types of vaccine made with a new technology called mRNA. What is this and how does it differ from other vaccines that we're familiar with, like the flu shot?
Messenger RNA is a new type of vaccine technology. It has been studied for a couple of decades and has been researched for things like cancer vaccines. Messenger RNA is a molecule that we all make billions of copies of in our own bodies every day. And the way this vaccine works is that messenger RNA is in the syringe and is injected into your arm. That messenger RNA is taken up by muscle cells and other white blood cells in the area. And the messenger RNA tells your body to make the spike protein from the virus. When your body makes the spike protein from the virus, that's recognized as foreign. It doesn't belong there. So your immune system learns what the spike protein from coronavirus is. It makes a response and develops antibodies, and other parts of your immune system learn about the spike protein. The coronavirus has the spike protein, and if you're exposed to it later, your body says, oh, this is that spike protein. I know what to do about this, and binds it and prevents infection. And so this is a molecule that's common in your body. It's a little strand of RNA that we make all the time. And this little strand of RNA is particular to code the spike protein of the virus.
One of my concerns, and I think it's true for others as well, is the speed at which this vaccine has been developed. How is it able to be done so quickly, and how does that timeline compare to the development of other vaccines?
The speed of this vaccine is one of the real miracles of modern science. The difference between this vaccine development and other vaccine development like Prevnar or Menactra or the hepatitis A vaccine, the steps are the same. And they were all done. Every step was done on this. But for those other older vaccines, each step was done one at a time over a period of about 6 years. For this vaccine, the steps were all done at the same time. So meaning, if you're developing a Prevnar or a hepatitis B vaccine, you figure out what kind of vaccine you want to make. A live virus vaccine or a bacterial protein, you figure out what kind you want to make. You develop the vaccine, you do a phase 1 trial to look at dose, you do a phase 2 trial after that, where you look at about 500 or 1,000 people and you give them the vaccine and you see if it's safe. And then you do a phase 3 trial of 10 or 20,000 people to see if it works. After that, you get FDA approval And then you say, let's make the vaccine. That may take a year. And then you distribute the vaccine, and that may take another 6 to 12 months. So that whole process for all the other vaccines we have can take 6 years. But for Operation Warp Speed, a couple of things worked in our favor. Messenger RNA technology was available. There were the machines and the scientists, and those things existed in labs. And so because that is an easier way to do a vaccine and was readily accessible, that vaccine itself could be developed quickly. Then you have the phase 1 trial, which was completed and documented the correct dose. And then normally for a phase 2 trial, it takes maybe a year or two to get 100 volunteers or 200 or 500 volunteers who want to be a volunteer for the vaccine. And after that, it may take another 2 or 3 years to get 10 or 15,000 volunteers. So because there's an active pandemic going on, there were 30 or 40,000 volunteers overnight. So you didn't need to spend 3 or 4 years finding volunteers. That happened in 2 days. And then to see if the vaccine works, there has to be enough disease in the community to cause enough infection to see if the vaccine is better or the placebo is better, or if they're equal. And normally that may take a couple of years. But in this case, the pandemic was so bad that in that group of 40,000 people that were vaccinated, enough of them got COVID right away that we could see that the placebo recipients had a lot of COVID and the vaccine recipients didn't. So that endpoint was reached quickly and very safely. The other thing that happened was through Warp Speed, the vaccine was being tested at the same time it was being manufactured. At the same time, plans were being made for distribution. So everything happened all at the same time. And the plan was for vaccines paid for by Operation Warp Speed that were determined to be ineffective or that didn't work, the government paid for that. And those vaccines from other companies, if they don't work, they just throw them in the trash. You'd never get a vaccine company to make 100 million doses of a vaccine and take that financial risk. But Operation Warp Speed paid for that. Mm-hmm. So the fact that there was plenty of disease, the fact that everything was done at the same time, instead of one after the other, allowed very safe development of vaccine in about 10 months so that we can get it. I've gotten both of my doses, and I think it's very safe, a very safe vaccine. So I don't think anything was shortcut.
Okay. The vaccines have been approved for emergency use, but are technically still in that phase 3 clinical trial period. Is it normal for a vaccine to be released while still in a clinical trial, or is it unique to just the COVID vaccine?
I'm not sure that a vaccine's ever been released for an EUA before. And the reason that is done is because when there's been a pandemic declared, the FDA is allowed to use a vaccine or a monoclonal antibody or an antiviral medication if it's believed that the benefit outweighs the risk and it's deemed to be safe from everything that's known about it. And so the phase 3 trials are still ongoing, which means that for the 40,000 people in the trial for Pfizer that were vaccinated, they are still being watched and we're still collecting data. Well, I'm not, but the company Pfizer is still collecting data on those patients and we'll watch them going forward.
Would we know by now, by this stage in the trial, if there were big side effects with the vaccine?
You cannot say 100% sure, but what you can say is this. They watched about 20,000 people who got the vaccine for 2 full months and looked at every adverse event that happened to those people. When you look at the side effects from all kinds of vaccines throughout history, all of the serious side effects happen within about 6 to 8 weeks. It's very rare to have a side effect from a vaccine after that time period, if it happens at all. So things like, we know that influenza vaccine can cause Guillain-Barré, which is a temporary paralysis requiring hospitalization. And it is a terrible side effect. That happens about 1 out of a million doses of influenza vaccine, and that happens within 6 weeks. We know that with the measles, mumps, rubella vaccine, you can get low platelets. That happens at about 3 weeks. We know that with any vaccine or medicine, you can have anaphylaxis, which is a severe life-threatening allergic reaction. That happens within 2 hours. And so for the vaccines that are known throughout history, there's no significant major side effect that's long-term. The only one I can think about is with the measles vaccine. There can be chronic measles infection that can lead to problems even a decade later, but that's a live virus vaccine.
Mm-hmm.
This has no virus in the vaccine, so that would not even be a consideration for this.
Have there been studies specifically on the safety of the vaccine in children?
There have been some children 12 years of age and older in the vaccine trials, but it's not enough that it has been licensed for children yet. So there are some trials, and there are trials currently enrolling pediatric patients with Pfizer and Moderna. I believe that one of those companies, it goes down to age 5, but I'm not positive about that.
So when do you think, or do you have any information on when those studies might be complete and when we might know more?
I really don't know for sure. I think everyone is hopeful that we'll have some results by the spring, in the next 3 or 4 months, but I honestly don't know.
So I guess the million-dollar question is, when do you think the vaccine will be available for children, and what has to happen really before the FDA approves that for kids?
There will have to be trials that document safety in children and document that it works, and then it will go through the FDA just like it went through for the adult COVID dosing in December. And then the FDA will give a yes or no. And then the ACIP, the Advisory Committee for Immunization Practices, will give a recommendation. So the FDA will give permission to use it in children, and the ACIP will say here's when and which children to use it in. And so that I hope it will be here before the summer, but I don't know.
Okay. What benefit is there in vaccinating a healthy child if the statistics show that 99% of healthy children who get COVID are going to recover and do just fine?
You could say that for chickenpox, and you could say that, for a lot of things that kids get vaccinated for. I think when you look at a pandemic and you look at transmission of virus, you have to stop transmission of the virus. And even though children are not great transmitters of the virus, they still do that. And so you would want to add them in safely if the vaccine is safe in children. You would want to immunize children to remove another place for the virus to land. You want as much of your population as possible to be immune to the virus, to slow down community numbers and stop the pandemic spread.
So we know that COVID has a greater impact on individuals with underlying health conditions. So how should parents who have children who have underlying health conditions, how should they consider that condition when making a decision about the vaccine?
They need to talk to their doctors. They need to see if the underlying condition puts the child at increased risk for problems with COVID disease, and make that decision with their doctors. That there is not a tremendous amount of data in immunocompromised hosts or other conditions, but there is some data, and they'll need to talk to their doctors about their child's specific situation, keeping in mind that if their child catches COVID infection itself, that may be riskier than the vaccine. So there's always a choice. If you decide that you don't want to do the vaccine, you are saying yes to ongoing risk of infection. And depending on your condition, that may be a reasonable choice. It just needs to be worked out with your physician.
Okay. Are there any medical conditions or health issues that should prevent a child from getting the vaccine?
You would not want to get the vaccine if you are allergic to the vaccine components. That's the only thing. There's not a known proven medical condition where the diagnosis is an absolute no to the vaccine or an absolute contraindication. But you don't want to get the vaccine if you've had anaphylaxis to the ingredients in the vaccine, or if you've had anaphylaxis to the first dose of the vaccine, you wouldn't get the second one.
Do we know what ingredients, other than, I guess, the mRNA, are causing those allergic reactions?
It is thought that part of the allergic reaction may be the polyethylene glycol, or the PEG, that's in the vaccine. There are some individuals who are allergic to polysorbates, and that can cross-react with polyethylene glycol. So people that are allergic to either of those two compounds that would be a contraindication for them to get the vaccine. There are a list. It's a very small vaccine. It contains the messenger RNA and a fatty or a lipid capsule around that little piece of RNA. And there is a list of what's in that capsule on the Pfizer or the CDC or the FDA website. And basically it's polyethylene glycol plus a long list of lipids with very long 30-letter names that I can pronounce if I have it sitting in front of me, but you just have to read the list. There are no adjuvants in the vaccine, which we use in other vaccines to make them work better. There are no adjuvants in these vaccines, and there are no preservatives in these vaccines.
So I've heard that one of the complications of COVID that we see in kids is called MIS-C. Explain to us what that is.
MIS-C stands for multi-system inflammatory syndrome due to COVID disease. If you catch the SARS-CoV-2 virus, you can get an asymptomatic infection or a symptomatic infection with cough, fever, shortness of breath, those things. And there are some children who about the third or fourth week after they start their infection will develop an inflammatory syndrome. The first part of their initial infection may not have any symptoms at all, and they can still get this inflammatory syndrome. The inflammatory syndrome is not something you will miss. Children, by definition, have high fevers and appear very ill with this. They have very abnormal blood values for inflammation, and they have evidence that multiple organ systems are involved. They may have inflammation of the heart, which we can pick up with lab tests. They may have inflammation of the kidneys or the liver. They often will have a rash on their skin. They might have pink eye. They might have red swollen lips. But I think the takeaway for parents is that they are ill, and they have fever, and they do not feel well. And so when we see those children, they're admitted to the hospital. They frequently require intensive care before they get better.
So how should we consider MIS-C in talking about weighing the risk and benefits of the vaccine for kids? I mean, is it a high fatality rate?
MIS-C is a high morbidity rate, meaning children are terribly ill, often in the intensive care unit, occasionally on life support. You don't want your child to get MIS-C. It's serious. And for reasons that are not clear to me, the mortality rate is very, very low, which we are so grateful for. There aren't very many diseases like that. These children are terribly ill, and the huge majority of them live through that. They don't live through that unscathed every time, because sometimes they will have ongoing damage to the coronary arteries or to the heart. And so when the data comes out in children, the hope is that it will show that those who are vaccinated not only are protected from COVID, but you would expect that they will also be protected from getting MIS-C. And that data should be forthcoming.
We talked a little bit about some of the side effects of the vaccine. What are some of the side effects and adverse reactions that we're seeing with the vaccine in the current population that's getting it?
there are a group of side effects that are part of the reactogenicity or part of your system saying, hey, I need to do something with this new spike protein floating around my body. And those are in those first 48 to 72 hours where people have headache, muscle aches, fever, chills, joint pains, sometimes redness and swelling where they get their vaccine. And that is in about 20 or 30% of people after the first dose, and might even be 40% of the people after the second dose. And that's all gone by 72 hours from all the vaccine studies. And so those things can be very miserable. Some people can't go to work from that. And then they go away and they're fine. And in the scheme of things, that's a lot easier than getting COVID. The other side effects from the vaccine would include anaphylaxis, where you have a life-threatening allergic reaction within 2 hours of the vaccine dose, and often within 15 to 30 minutes of the vaccine dose, most of the time. You're more at risk for that if you've had anaphylaxis to something else in the past. To my knowledge, there are in the ballpark of the low number of 20s, absolute number of anaphylaxis cases in the nation. It's thought that that happens in about 1 out of 90,000 doses of the vaccine. So that is a life-threatening reaction. I have read and have not seen any deaths from that. All of those people have recovered and gone home from the hospital. They can't get their second dose, obviously. That's probably the most serious side effect. And then there are some things that we're not really sure about whether or not they're from the vaccine. If you watch 20,000 people for 2 months, you can expect some of them will have a heart attack, some of them will have a stroke, some of them will be killed in a car wreck. All of those things happen. And so when you watch a large group of people for 2 months, it's not always easy to tell if the vaccine triggered the problem that happens. We know that in the Pfizer trial, there were 4 cases of Bell's palsy, which is paralysis of one side of the face, that almost always completely resolves, but not every time. There were 4 cases out of 17,000 people that were vaccinated of Bell's palsy, and there were no cases of Bell's palsy out of 17,000 people that got the placebo. But 4 cases out of 17,000 is actually not above the baseline rate that you'd expect. So nobody really knows what to make out of that information. There were 12 cases of, I think these numbers are right there close. There were about 12 cases of appendicitis after the vaccine and 8 cases after the placebo. So a tiny difference, but not different than the background rate. So there are some side effects that you'll read about that are hard to determine if they're related to the virus. But for sure the anaphylaxis is, in some cases, and for sure the reactogenicity side effects can be seen from the virus, from the vaccine.
So if our child has a history of allergic reaction, should they avoid the vaccine?
If they have an allergic reaction to something not related to the vaccine, a food allergy, a penicillin allergy, a bee sting allergy, if it's completely unrelated to the vaccine, they can still get the vaccine once it's approved for children, but their 15-minute observation period will be 30 minutes instead. Okay. Any child that's had an anaphylaxis type of reaction to anything, they need to talk to their doctor first before they sign up for the vaccine and go over that with them.
Okay. So do we know yet of any long-term side effects? And I guess the question really would be, what research is ongoing to track them? When would we know that?
The people that are in the phase 3 trials, it's my understanding that those companies will follow those recipients for 2 years. Okay. And they've already been following them for 6 or 7 months. One of the things that you have to keep in mind about long-term follow-up for these vaccines is that in the current pandemic, you can't really justify waiting another year to release these vaccines, because with 3,000 or 4,000 deaths a day in the country, it only makes sense for something that's been proven to be safe and there's no known long-term side effect, that the benefit of the vaccine at this point outweighs the risk of getting COVID.
Okay. One of the things I've heard about the vaccine is that it changes your DNA. Is this true?
No, the vaccine injects messenger RNA into your cell, your muscle cell or your white blood cells nearby, and it never enters the nucleus where the DNA is. So it doesn't integrate itself into your DNA, and it actually, the messenger RNA particle is very fragile, and it's not even around for very long. It disintegrates and goes away very quickly, which is why the vaccine has to have a deep freeze. And if you thaw it out for too long, it doesn't work. And if you open the freezer for too long and it gets at the wrong temperature for too long, it's inactive. So it's a pretty fragile particle, and there's absolutely no evidence that it integrates into your DNA.
Okay. I've also heard that it can cause infertility. Is that true?
No, we know that during the vaccine trials, again, when you have 17,000 people that you vaccinate and you watch them for 2 months, some of them get in a car wreck, some of them have a heart attack, some of them get pregnant. And that did happen during the vaccine. There were pregnancies during the vaccine. And there's not really any reason to think that it would do that. The spike protein, I think, has been shown to look like a placental protein. And there was some theoretical question about antibodies to the spike protein may cause a problem with the placenta, but that's been shown not to be legitimate scientifically. And if you think about it, if you make antibodies to the spike protein from the vaccine, that's exactly what you're going to do if you catch COVID infection. Either way, you get antibodies to the spike protein. And so if the COVID infection doesn't make you sterile, the vaccine wouldn't either.
Well, that leads to another question. Is it safe for use in pregnant women?
It's recommended that pregnant women speak with their physicians and make their own decision about that. Pregnancy is it is agreeable and allowable to vaccinate pregnant women. The CDC has said that you don't even really have to check to see if they're pregnant before you vaccinate them. And if pregnant women want the vaccine, they can get it. The American College of OB-GYN has said there's not really any reason not to vaccinate pregnant women. And so what is recommended is that pregnant women talk to their own physicians and make their own decision. And again, they have to keep in mind that if they catch COVID infection during the pregnancy, they fare worse than if they're not pregnant. It causes more severe illness.
Are there any other common myths about the vaccine that you want to address?
There's no government implanted chip. I've heard that one, that you get implanted with a chip when you get vaccinated and that they're going to track you. And all I can say is if you have a smartphone, there's probably already someone tracking you. And it's just ridiculous. But that's been on social media, and no, there's not a government chip implanted.
Anything else that we've missed and you want to cover?
I don't think so. I think that's everything.
Okay. Well, thank you for joining us. And maybe when we have more information about kids specific to the vaccine and those studies are complete and that's released by the FDA, we'll be able to come together again and answer parents' questions.